And so those tribes that were forced to go to Oklahoma did receive some support from a vaccination program, and that was kind of seen as sort of a exchange. There were other tribes that also were vaccinated. Interestingly, I'm Mandan and Hidatsa, as Danielle mentioned. The Mandan and the Hidatsa and the Arikara, which is the third tribe that's located on the Fort Berthold Reservation where I'm from, were deliberately not vaccinated. And so there's records from the War Department and some of the, secretaries of the time who noted that in certain circumstances, that Mandan and Hidatsa and Arikara members had, acted against the U.S. in some of the incidents, around in North Dakota, I guess, at that time, and so they were seen as hostile, and therefore deliberately decided to limit vaccinations and not actually make them available. Soon thereafter, in 1837, smallpox, ripped through our communities, and we lost 60% of the population in the Hidatsa tribe and 90% of our population in the Mandan tribe. And we were actually agricultural. We still are, but have always traditionally been agricultural and grown corn and beans and squash in the Missouri River bottoms. And so we lived in earth lodge villages in that area, and the villages were clustered together in maybe like there's estimates historically of having up to 20,000 residents in our villages at one time, maybe even more for some of the larger villages. And so the conditions were such that smallpox, had a easy way to gain, a quick foothold. It didn't take much, but we were all located in a fairly, single place and stayed there. Didn't necessarily move around too much, and so it was able to kind of really have a huge impact in our communities. And so, it's one of those, I think, situations where it's still painful to think about, the fact that there was a vaccination act that had been enacted, that there were tribes just south of us who were vaccinated, including the Lakota and some of the Dakota groups in Minnesota. And just by a few years, we, weren't able to see that practice occur among our tribes in the upper Missouri region, and immediately, had huge repercussions because we didn't have vaccination available to us. My grandmother actually told a story, and my sister, who's a historian at University of Denver, found it as she was doing her dissertation research. And my grandmother related this story about, what happened to my great-great-grandmother, who actually lived in one of the villages who was impacted by that 1837 smallpox outbreak, and talked about how, she was burning up with fever and decided to go down to the river. And in our cultures, the river was seen as, had its own presence or spirit, and was seen as a healing in many ways. And so she went into the river and immediately cooled off, and her fever must have broken. And so she came back up to her village and was telling people, if you're sick, go down to the river and cool off, and you will feel a lot better. And so there's, stories like that still survive, across multiple generations about the experiences that people had at that time. during the 1837 smallpox outbreak. Another story came from my grandmother's sister, my other grandmother, Emerine Chase, and she related that her mother had told her that her great um, grandmother had talked about what it was like for people when the smallpox epidemic hit. There was just so much loss of life that people knew that they had to move out, and they ended up, tying their infants in trees to keep, them away from scavengers and animals. And they were still crying and wailing. And the reason I guess I share those stories with you is that these are stories, I'm sure are not uncommon, and they're passed through generations, and they inform our perceptions of disease today in our tribal communities and urban Indian communities. And they also represent, kind of this shared historical trauma of some of the things that occurred due to contact. And so I think it provides context for the work that we're doing today in terms of our public health response to COVID-19, and helps us understand why in our communities there are a lot of different feelings and perceptions of medical care, and also the risk of disease, and the distrust also, because the smallpox actually came from uh, a steamer that came up the Mississippi and then up the Missouri River, and one of the um, uh, passengers actually had smallpox, and that's how it was introduced to our communities. And so, there's a lot of that shared history that informs, how we view um, uh, things still today. I want to just talk a little bit about some of the history in Arizona, because I know a lot of folks are coming from tribes in Arizona today, and we still see smallpox being a huge issue for tribes in Arizona. In 1853, the Hopi tribe was decimated by smallpox, and the records demonstrate that nearly all of the adult men died in 3 of the Hopi villages in the 10-year period from 1859 to 1869. There were colonizers who came to the Gila River area and started to basically just take lands along the Gila River to establish their farms, despite getting warnings from the US government that they should not do that. At this time, Arizona was still a territory, and the reservation era was just beginning in terms of kind of the federal policy of, establishing reservations specifically for tribes in Arizona territory. And some of the epidemics then that swept through the Otham communities during this time came from, those folks who moved in and decided to, kind of take over and establish those farms. In the 1870s, and in 1870 actually, Captain Grossman, who was a member of the U.S. Army and was special agent to the Tohono O'odham Nation, hired a physician to implement a vaccination program and was able to vaccinate many of the folks from that community. However, as we see, today, it was a very challenging effort to get vaccination out to these communities, and it wasn't necessarily a priority. It costs money. We hear about, even back to the vaccination program in Guatemala. Actually, those Mayan communities were charged in order for the Guatemalan government to send physicians out to inoculate the Mayan communities. They were actually using money that was paid for, through those Mayan communities through taxes, and it was not something that was set aside as kind of a deliberate, appropriation for public health response. It was always something that was kind of a little bit more ad hoc. And so it was not something that one could rely on in terms of sort of a coordinated national response to smallpox. And so then as a result, we saw these other communities like at Fort Mojave and the Quashan community who also, were devastated by smallpox epidemics and, didn't really have the same support in terms of a vaccination program in those regions. These are just, I thought this was, interesting to share some of the historical, um, surviving materials that were used in these inoculation programs and vaccination programs. These are actually on the left, some ivory points, they called them, and they were carved so that, they were very sharp at the end and they could kind of, you know, uh, create, like a incision and introduce, the vaccine into a person's bloodstream. And you can see on the right, there's a capillary, couple of capillary bulbs um, that were used to introduce the vaccine in a slightly different way later on as medicine kind of developed new strategies to vaccinate folks. So I want to talk also about kind of the historical record in terms of tribal sovereignty and what that looked like during this time. So the Worcester v. Georgia case, the federal case that kind of started, to establish the foundations of federal Indian law in this country, established that tribes have inherent sovereignty. And so the US Supreme Court recognized that in that particular case. This was in the early 1830s, right around the removal of the southeastern tribes to Oklahoma. And in subsequent cases, the Supreme Court held that without, governing acts of Congress, the question has always been whether the state action infringed on the right of reservation Indians to make their own laws and be ruled by them. And so as part of that bundle of rights that inherent sovereignty represents, those rights include tribes' ability to make their own laws and enact them and also enforce them within the boundaries of their reservations. And part of this kind of discussion through the years of U.S. Supreme Court cases establishes sort of how that works vis-a-vis the U.S. federal government. And and also kind of justifies, why that was the case. There's a whole history, and this article by Green and Work describes a little bit of it. There's a book that is a federal Indian law case book that also does a really great job if you're interested in kind of mapping out historically, what the legal basis was. It really originated with the Pope. With a series of papal bulls when folks from Spain and Portugal were first sailing into this region. It was authorized through some of these documents that were developed from the Pope at the time, and also was supported by some of the monarchies from those countries. And it really sort of established, this right to basically, upon quote unquote discovery, take land, take resources, and claim them in the name of those countries that were, in support of these papal bulls. And there's a whole great discussion of that in the Getch's Federal Indian Law book. And so when America, started to become a country, some of the Supreme Court rationales were really based on, hundreds of years of, colonization and some of the European laws and systems that kind of enabled those early journeys to occur. So, as you can see from the Talton v. Mays case, the Supreme Court held that tribal powers of government predate the United States, and thus tribes are not federal entities. So, there's a recognition that even before the United States became, a nation, there were nations here already. And again, that is really well described in that federal Indian law casebook. So in terms of, inherent sovereignty, only tribal governments have an authority to enter into a government-to-government relationship with either, primarily the federal government. There are also contracts and agreements in place between tribes and the state government, sometimes county governments or municipal governments, for maybe resource sharing in terms of mutual aid agreements or data sharing agreements, other types of cross-jurisdictional agreements. And tribes have the authority to carry out programs in accordance with tribal laws and regulations. And so, there may be state laws, for example, that, inform data collection. Tribes don't necessarily need to follow those laws. They do need to, align with U.S. federal law, but their sovereignty is, set above and beyond, the jurisdiction of states and counties and municipalities. And so tribal policies can dictate how certain grants or contract requirements are met. And so we see that here in Arizona today, when you look at the COVID-19 response, dashboard, you can see that there are exclusions of data because tribes decided, that they did not want to be included in the data dissemination for COVID-19 because it can be stigmatizing. There can be negative impacts for some of those reportings, and certain tribes decided to opt out of sharing that information more broadly in order to protect their populations. In terms of the limitations of tribal governance, there are many things that are still available to tribes because of that inherent sovereignty, and only Congress can infringe on tribal sovereignty. It has to be through legislation, and it has to be explicit. It has to take into the consideration this special government-to-government relationship. And the executive branch has to adhere to this role that it has in carrying out the intent of congressional legislation. And you can look at President Biden's executive order from earlier this year to read through and examine, what that policy looks like in terms of tribal consultation. That is part of that government-to-government relationship and ensures the communication and a process for how the federal government and tribal governments interact and communicate with one another, and also how federal agencies then are required to meet certain communication parameters in order to ensure that they're meeting this government-to-government relationship and the expectations and the legal requirements that go along with it. All of this, comes into play because tribal sovereignty informs tribal public health authority. And so, we've seen this with the COVID-19 response. This is just one example where the Navajo Nation has issued, multiple stay-at-home orders in order to protect the Navajo communities from COVID-19 spread. And, we've seen this time and again, not just in Arizona, certainly across the nation. Some tribes have put up roadblocks. They're checking temperatures and asking about COVID-19 symptoms. And because they're doing this within, the boundaries of of their jurisdiction on the reservation, that is part of an exercise of tribal sovereignty. And it also, speaks to tribes' public health authority to institute these types of regulations and policies and implement them and enforce them in order to protect the well-being of tribal members. Some of the things I think that we can look to that we have learned from this past year, although it has been tremendously difficult, and we've seen massive loss of life in Native communities, and also the impact of disease, severe disease. There are some things I think that we can use in the future that can inform our public health responses and improve them and strengthen them. And so this article by Yellow Horse, Yang, and Moiser just came out earlier this year, and kind of does this really beautiful job of mapping out, where are some of the Native communities in Arizona, where are the density of populations for different groups in Arizona. You can see in red in the middle map where some of the Native communities and populations are located. And then on the far right is a heat map of what the disadvantage, quote unquote disadvantage, looks like for certain areas of Arizona, because they were looking at some of the conditions that were maybe risk factors for COVID-19 infection. And so they note in the graphic that some of the data is not available because of tribal sovereignty, that the Navajo Nation decided that they're going to limit sharing of data, and perhaps other tribes have as well. And so that is certainly their right under their sovereignty and public health authority. I think interestingly, though, these maps kind of speak to how we can then think about our public health responses if we know already that there are regions where there are disparities in terms of some of the socioeconomic conditions. And we know that there are populations of American Indians and Alaska Natives who may live in a certain area and be facing those types of conditions. Then we can plan accordingly. We can develop responses that can actually be more targeted and be more hopefully effective and efficient as well. And so this is just one example of a tool that has kind of come out of some of the analyses that have occurred over the past year. So in summary, I just want to kind of looking to the future, thinking about like what are some of the strengths that we have already demonstrated and that we're developing in terms of our Indigenous community response, and how we've really drawn from the resilience that's already part of our communities and also strengthen that resilience, and kind of look to like what are some of the potential options in the future. I think that data-driven decision making, can certainly be an exercise of tribal public health authority. What that looks like certainly has to be informed by the tribal government in question, and each tribal government has the authority and the ability to make that decision on their own. We heard about in previous sessions in this series about how White Mountain Apache has developed certain relationships outside of the reservation with Johns Hopkins University and with some of the local counties in order to be able to tailor the COVID-19 response for their communities. And so, there are some really impactful and important ways that tribes have exercised their sovereignty and also exerted public health authority in their jurisdictions. And I think, those are really useful ways to kind of learn and see, what might work in other communities, not just tribal communities, but communities around the nation. And so I think the other thing that we haven't quite touched on to a large degree is thinking about and planning for the behavioral health needs and social welfare needs of COVID-19 survivors and family members who have been touched by COVID-19. And it's not just at the family level that we need to be concerned about this, but also the community level. As part of my work, I have the privilege of providing some technical assistance support to tribes who are receiving grants to address COVID-19 response. And we've heard stories, about some communities having, a huge impact and, parallel to that, they're also seeing, an epidemic of overdose in their communities at some times, and also suicide risk. And so, we need to be aware of the fact that there are behavioral health effects when we go through these kinds of really challenging, situations, and we need to understand what that looks like for our communities so that we can mount an effective response. In addition to that, I would just suggest that we also need to think about some of those diverse groups within our communities that, we need to take special care around and make sure that they have access to services and resources so that we are protecting them, just like, other groups across our communities. So when we're thinking about, LGBTQ and Two-Spirit community members, are there certain things that we need to be aware of in order to be able to make sure that there's, an inclusive approach built into our programming. I know that a lot of communities have focused on elders, and making sure that elders are receiving vaccination and other types of instrumental support in order to get food and water and other resources throughout the pandemic. And so I think, there are instances of this. I think it would be helpful to share this information, if it's possible, with other communities so that we can all, learn together about how we can mount an effective and efficient response, particularly for some community members who might have certain vulnerabilities that, we need to support them through. So in closing, I just like to say, Matikidads, thank you so much for having me today. I have saved a little bit of time for questions or comments. If you'd like to share, we'd be more than happy to hear from you all, so that, this is an opportunity for everyone to learn together about, what we're experiencing. And just thank you, and really grateful for this opportunity, and want to thank the Intertribal Council of Arizona for making this possible, and just welcome any comments or questions today.
Thank you so much, Myra. I do see that there is a question in the chat around I can read the whole thing. We value the government to government relationship. It's important in our work, but do non-federally recognized tribes have any inherent sovereign rights? The examples I can think of, or I know of, are the Hayasid Oatam and the Kickapoos in Arizona without a federal land base. It's a worry, but maybe a topic for another day.
Yeah, thanks, Alita. Thanks, Danielle. I think that's a really great question. Unfortunately, because they are not federally recognized, tribes that are not federally recognized are not seeing as retaining inherent sovereignty, and so unfortunately, it's a huge struggle, I know, for a lot of tribes who don't have that federal recognition. There are situations in other states, that where there are state recognized tribes, and so there are some tribes who don't have federal recognition that have state recognition, and they're able to kind of navigate sort of a different space in terms of exercise of some of their sovereign rights. But it is a huge challenge, and it's also you know a problem in terms of when we think about kind of how the vaccination efforts, for example, took place in the U.S. with the federally recognized tribes. There was a process that was established, and they had an opportunity to choose like how those doses were going to be received, and it was all planned out. So for any groups that are not recognized, they don't have that same kind of government to government relationship, and so they don't have that access to like a coordinated response specifically for their community. And so we see that there are certainly probably some gaps when we think about protecting American Indian and Alaska Native people in the United States, and folks who don't have access to some of those services. Then how can we ensure that they have sufficient support and access to not just vaccines, but healthcare in general. I think it's an ongoing issue, and an ongoing challenge for those communities.
All right, and we have another question. Do you think the language use of innate sovereignty would support raising awareness for federal, state, local governments to enter into discussions, informal consultation for non-federal recognized tribes?
Well, there's a whole history of federal Indian law that talks pretty specifically about tribal sovereignty and inherent sovereignty, and the powers that are vested in tribes, and those are the Native communities that are federally recognized. And it's complex. There are a lot of layers to it. So it's not so much about word choice. It's about kind of the origins of how the United States and tribes first began to interact, and even prior to the formation of the United States, how tribes signed treaties and had other types of agreements with colonizing nations like Britain, France, Spain, and that whole history then is how this notion of inherent sovereignty was mapped out in those early Supreme Court cases. There is a federal process that has been described and used by some tribes to obtain federal recognition. And I don't have that off the top of my head, but there are certain types of criteria that those communities need to demonstrate in order to achieve federal recognition. And it has occurred. It's not necessarily always tied to kind of the language. There's a lot of documentation that's needed through historical records, and kind of establishing what the community's land base was prior to contact, and a lot goes into that. And so there is a process for that. I know that it is very challenging for non-recognized tribes to go through that process, but that's the avenue that has been established for communities who may not currently have federal recognition.
Thanks so much, Myra. I think what you've shared today has been super helpful. I do have a question, I guess, for the group in general, and how do you all plan to kind of share this knowledge back with your communities or use this in your current public health practice? Um, I get to work with Myra quite frequently, and have heard her story before about her community's experience with the vaccines. And actually, I was chatting with one of my younger cousins who doesn't necessarily have like the history or background of like the public health systems or healthcare in our community, but he was asking, why do we have to wear our masks still? Why do we have to like continue to push vaccinations? Like, it's just the common cold. Like, he had all of this language he had been hearing from media or his friends and whatnot. And so one way that we really, I think, reached him was just talking about our history. And, you know, in our community, our population went down to 1,000 people. And like, we really had to fight to survive and care for each other. And that's what we're seeing today. So like these efforts have a long history in our communities, and that community care has a long history, and it's also supported kind of through these inherent rights. So I just appreciate you sharing that. And if anyone else wants to share how they plan to kind of use the history in their work, I definitely welcome that, either through the chat or if you want to come off of mute and share.
Hi, Myra.
Hi, Alita. How are you?
Okay. Getting gray.
Me too.
So that's okay. Hey, so your last slide talked about some possible next steps. And I guess what we're hoping is that the public health approach will be valued more highly, and things won't happen like cut the funding for CHRs, phase them out, those kinds of things. Um, but I understand. I'm with a group of fellow staff members at ITCA where we talked about vaccine hesitancy, and I know that still exists within our communities. So we've talked about different approaches and had some good discussions. But even other types of vaccines, there are members of our communities who maybe they're anti-vaxxers. And I guess when you showed the slide about the smallpox vaccine, that was new information for me about that. Even that was made available to Indigenous communities. Maybe we didn't have federal recognition then because the Reorganization Act hadn't been passed, but there was an effort to vaccinate our people for smallpox. And was there a fear of was that successful? Maybe I didn't catch it. Was that successful? And was there a fear of using, quote unquote, the white man's medicine?
Definitely. Yeah, I didn't quite get to that. That's a really great question, Alita. In the historical records that I've seen, there was definitely evidence that there were tribal members who were certainly fearful of Western medicine, and I think also very much convinced that they had their own medicine. There were medicine people in their communities that they accessed when they needed healing. And there's a really great report, actually, and I can email it to you, and we can make it available to folks. There was I think he was an anthropologist. He was actually from I think Bosnia, and he was charged. His last name is Herdlicka, and he was charged to develop a report on the health of American Indians in the Southwest. And so it's a wonderful report, and it's free. It's online, and it talks about. I mean, wonderful in the sense that it's amazing to see all this data collected. There are definitely he has other issues with his work. He sort of a little bit of Darwinism and all kinds of stereotypes that were definitely also perpetuated about Native people in his report. However, at the same time, it was the first effort to kind of document, what health and public health looked like in Arizona and some of the other communities around Arizona, and I think Southern California and down into Baja California. And he talks about how there were, like today, a variety of issues that, you know, uh, Native people, were concerned about when it came to vaccination. And so, and not just vaccination, for smallpox or, whatever other diseases were available to, have vaccinations at that time. And he wrote this in 1908. And he did such a great job, though, of documenting the prevalence of tuberculosis within tribal communities in Arizona, and also sarcoma, which is like an eye disease transmitted by, different bacteria spread by insects and different things. And it was huge for some communities. So there were 50% of people who were having to deal with tuberculosis, for example, in some communities, which was another disease that was introduced, from colonization. And actually that report helped to establish, the hospital at the Phoenix Indian School. And so it was built and funded by the US government. I think it was like $12,000 that was appropriated to build that or revamp the hospital. I think there was a clinic there at the school. And so his report actually helped, make that resource available to not just the children, who attended Phoenix Indian School, but also, other community members who needed support. It also helped build and expand the tuberculosis unit at the Phoenix Indian School. And so they were able to treat folks who had that disease more effectively. And it was, filled fairly, at capacity while it was available. And so it's a really interesting history, I think, that, is there in these records. And I think, it also, as you were mentioning, that report talks a lot about traditional medicine use, belief systems around healing and wellness. And there are, a variety, I guess, of sentiments about, the risks of not just vaccination, but receipt of Western medicine at that time, because, tribes had their own system that they used, and as far as they could tell, it was working really well in a lot of ways. He talks about how there's a holistic approach to healing, looking at kind of the behavioral health aspects of wellness and healing, as well as the spiritual aspects of well-being in, you know, some of those approaches. Of course, it's seen from, you know, a Western lens for sure, but you know, I think it's a really interesting exploration of what that looks like for tribes in Arizona. And we see that today, right, with COVID-19. And like you mentioned, not just COVID-19 vaccinations, but other vaccinations as well. And the need to really understand what that looks like and why people, you know, are, you know, either have these beliefs or have really strong emotional responses, and be able to talk through that in a way that helps folks kind of understand and weigh, you know, the risks and possible benefits.
Yeah, I was surprised that, you know, we have high rates of vaccinations, what I've seen reported, but still there's this small number of folks that, you know, just hesitate overall. It's just scary because of their babies, you know, their children. But yeah, I do, you know, value traditional healing because, you know, our family is strongly utilize that. But there's some of these uh, epidemics and pandemics that we had not seen before, like smallpox. Yeah. Good
Well,
information today. Thank you.
thanks, Alita.
All right. Does anyone else have any questions that they definitely want answered on the call today? You can go ahead and insert in those in the chat, but if not, we did insert a feedback form in the chat. If you don't mind taking that form and filling it out, we really appreciate it. And then I just want to say thank you again to ITCA for hosting these sessions and inviting us to collaborate with them. I've definitely learned a lot, and I hope you all have as well. And I'll go ahead and close out and just say thank you again, Myra, for sharing your knowledge and sharing that history with us all. And I definitely see it being used in our work. I'm going to play some music as we head out into the rest of our day and into the weekend. I hope you all take great care. This week has been hard. This year has been hard. And so definitely take care of yourselves and whatever ways that looks like for you. I'll play some music and bring up our feedback form, our final slide to move us through.
Thanks, Danielle. And thanks, everybody. I hope you have a great weekend.